rotation. So these are all the deep rotator muscles. So there's the piriformis, obturator internus and externus, gemellus superior and inferior, and quadratus femoris. So I'm going to have my patient sitting, the legs hanging off the table, and then I'm also going to put a towel underneath their distal femur of the leg of testing so that we can have that femur parallel to the floor. I'm going to have them sitting up straight, and then I'm going to have them hold on to the table to provide more stabilization. Alright, so the muscle that we're palpating is going to be the piriformis because it's the most easily palpated and it's the biggest. The others are way too deep. So, motion I'm going to have you do is external rotation. So I'm going to have you do this motion. So even though the leg is going medially, the femur head is going laterally. So, and you also want to inform your patient before you palpate because it's a sensitive area. So is it alright if I palpate your buttocks area? Mm-hmm. Okay, so for the piriformis, how to palpate it is you find the sacrum and then the greater trochanter, and then you go meet in the middle there. Alright, so that's my palpating hand, and then the stabilization, their weight is enough to stabilize them. So I'm going to have you perform that motion now. Good. Very good. So she can do that, so that's at least a 3, so I'm going to provide resistance. So one hand's going to be on the anterior and lateral distal femur, and then the other hand's going to be on the medial distal tibia. So it's going to be a counter pressure, so this hand's going to go medially and this hand's going to go laterally. So I'm going to have you do that motion, and then don't let me push you. Alright, good. So that would be 5 out of 5 for Max. If she's not able to do that motion, I'm going to have you in a gravity eliminated position, so I'm going to have you lay on your back. Alright, so okay, so the motion I'm going to have you do is we're going to start internally rotated and then going to go external. Alright, so we'll be palpating you again. So the stabilizing hand is going to be on the ipsilateral pelvis, and then the palpating hand is kind of harder since they're laying on their sacrum, but you find the greater trochanter and then you go in. Alright, so I'm going to have you start immediately again, turn your foot in, and then go out. Alright, good. So she could do that, so that'd be grade below a 3. So you can sit. So some clinical or some common substitutions for when they're sitting, they're going to laterally bend their trunk to lean to that same side to try to pick up their leg to do external rotation. When they're laying down supine, they're going to want to pick up that pelvis to do some rotation. So you want to make sure that they're sitting up straight, good posture, hands holding the table to provide more stabilization, and then make sure you inform them, ask them permission to touch their piriformis because it's a sensitive area. And